Hello, my name is Teresa Rosario, and I am a student at Cedar Crest College, and today I'm going to be talking to you about a study conducted by Donna M. Kazemi, Maureen J. Levine, Kazik D., Lindemann Soon, and Mary A. Nias called Effects of Motivational Interviewing Intervention on Blackouts Amongst College Freshmen. The research problem included alcohol and illicit drug abuse being a serious public health issue amongst college freshmen. During this critical transitional period from high school to college, these freshmen are more likely to engage in high-risk drinking and drug behaviors. Their research purpose was to examine the impact of motivational interviewing as an intervention on the rate of blackouts among these freshmen who engaged in high-risk drinking and illicit drug use. The objective of the study was to examine the impact of an MI program on the rate of blackouts amongst these participants between baseline and 6 months. The goal included reducing alcohol consumption and its negative consequences for these students, and the hypothesis stated by Kazemi was that, after implementing motivational interviewing, the incidence of blackouts will decrease amongst these college freshmen. There were 2 research questions, the first being, is there a reduction in blackouts over 6 months while participating in the MI program? And is there an association between the prevalence of blackouts and changes in the consumption of alcohol and drugs by freshman college students based on race and gender? Conceptual model. So the program was modeled after the MI harms reduction and alcohol skills training approach created by Demeeth, Bayer, Kivlahan, and Marlett in 1999. The design. So the study had a longitudinal design. The 188 participants were evaluated at baseline and again at 6 months after the MI intervention was implemented by the interventionist. The sample. So the sample initially consisted of 300 participants and then was reduced to 188. It took place in a large public university in a southern state. Convenient sampling methods was used, and there was no control group due to all participants being allowed to join in on the 4 sessions. And the acceptance rate was 63%, and there was no attrition rate due to all the participants joining in on these sessions. Variables. So there was an independent variable, which is motivational interviewing, and the dependent variable, which is the rate of blackouts among these participants. Intervention. So motivational interviewing was the intervention used for this study. It uses a non-judgmental, empathetic, non-confrontational, person-centered directive. And this intervention was implemented to examine the impact it would have on college freshman students engaging in these high-risk activities and their rate of blackouts. This was done using 2 50-minute sessions that were held at baseline and at 2 weeks, and then having 2 booster sessions held at 3 months and 6 months after the 2 initial MI interventions, just to reinforce what was stated. The intervention breakdown. So at baseline, orientation to the participants was given. Details about drinking patterns and behaviors such as readiness to change were assessed. Questionnaires were completed to assess alcohol use and negative consequences. And BAC levels, blood alcohol concentration cards, were color-coded by severity and were given to the participants that broke down into topics such as sex, weight, and number of drinks. At 2 weeks, discussion and questions were done on information and on self-monitoring, alcohol tracking, and BAC levels. Feedback was given to each participant individually about information gathered from the baseline assessment, and reactions were discussed with their interventionist. At 3 months and 6 months, the MI sessions were similar to the 2-week visit. However, personalized feedback was not given. Eligibility criteria. So inclusion criteria included being a freshman status, 18 and 20 years of age, being a full-time student, having a consumption of alcohol in the past 30 days, ability to speak and read English, and willingness to participate. Exclusion criteria included not meeting any of the inclusion criteria and not being able to participate in all 4 sessions. Ethical components. So the institutional review board approval was granted, and prior to completing the baseline questionnaires, informed consent was signed by participants and copies were given to them. Voluntary nature of the study, risks and benefits of participation were discussed with the participants as well. Data collection procedure. So 300 students were recruited from residence halls and classrooms in the university. Interested students received a phone call to screen them for eligibility. Once Once screened, participants were given informed consent forms that were read to them by the researcher, and then followed by a question and answer session. The MI intervention was then implemented by trained interventionists at baseline, 2 weeks, 3 months, and 3 months and 6 months as a reinforcement session. Participants also completed assessments that included the daily drinking questionnaire, the Rutgers Alcohol Problem Index, and the Government Performance and Results Act at baseline and again at 6 months. Data collection tools. So there were three tools used. The first being the daily drinking questionnaire, which was used to measure drinking patterns, including quantity and frequency. The Rutgers Alcohol Problem Index, which was designed to assess the frequency of occurrence of negative drinking consequences. And the Government Performance and Results Act, which was used to collect demographic information on mental and physical health problems, social connectiveness, unprotected sexual history, and alcohol or drug use. Study findings. So the study results showed a significant decrease in the weekly number of drinks, weekly number of hours drinking, and drinking days. Blackouts also decreased significantly at 6 months for 72% of the participants who had reported them at baseline. And these findings suggested that the MI program had an impact on the participants' alcohol consumption as well as their rate of blackouts. And also, their intervention was more effective in decreasing the females' drinking frequency in blackouts due to the findings showing that the frequency of blackouts was linked to gender. Limitations of the study. So generalization of the findings to other universities could not be done due to the study being conducted at a public university in a southern state. The study measures used to collect the data were self-reporting, so results are based on how truthful the participants were. The labor intensity of the MI program and the need for ongoing assessments and retraining of the interventionists was another limitation. And the self-selection in the sample and potential social desirability bias was another limitation since there was no control group or randomization. Significance to nursing practice. So this study has shown many implications for nurses. Healthcare professionals who are in settings such as hospitals and college dormitories that become involved in situations of drug and alcohol use among students can now use the MI intervention approach to help reduce and prevent negative consequences associated with these high-risk behaviors. Conclusion. So the MI intervention showed a significant decrease in blackouts associated with alcohol consumption. Motivational interviewing can now be used as a technique within healthcare professionals in preventing negative consequences associated with the consumption of drug and alcohol use among these freshmen. And these are my references. Thank you for listening.